Good evening and good to have you with us on this edition of the Urban Debate. For the second straight day, viewers, we begin our show with a big focus on Cyclone Amphan and the kind of destruction it has left behind, especially for the state of West Bengal that has not seen something like this in many years. And through the day, we got visuals and reports coming in despite communication lines being down, despite patchy network. We tried to get as much information as possible. Now, West Bengal Chief Minister herself confirmed that 72 people have died due to this cyclone that struck yesterday. Even as the state now reels under the aftermath, an assessment is still being made about the extent of damage that has happened to parts of West Bengal. In Odisha, the impact was limited. The state that's usually the one that gets ravaged by such cyclones saw lesser damage this time, but the bigger impact was on West Bengal. So tonight we start with the latest that's coming in from that state, and Tamal is joining me live right now from South 24 Parganas. Tamal's been on the road all through the day bringing us stories. Tamal, tell us what you saw through the day and what is the situation right now?
Well, Tanvi, since yesterday, having witnessed the entire horror and that too so closely, like all the people, even I am a little shaken. Because as you rightly began the broadcast by saying that Bengal has possibly not witnessed this in very long time. Yes, back in 2009 in the month of May, there was Ayla. That too was a super cyclone, impact of which was also felt in the state capital, Kolkata, and mostly in South 24 Parganas and North 24 Parganas. But thereafter, this seems to be the biggest challenge that Bengal has faced, the natural calamity that Bengal has faced in many decades. Mamata Banerjee has mentioned that 72 people have lost their lives. That number itself is quite shocking, given the fact that since yesterday, after there was complete power disruption, after there was complete loss of communications, we as journalists had failed to collect information from the ground. And after a lull of almost couple of hours, like 15 to 16 hours, when we heard this number 72, it was quite shocking for all of us. Well, the state government is also saying that there are a couple of districts, there are a couple of district magistrates they are still trying to communicate with. So possibly 72 is a developing figure and not a final figure or a holistic figure. That's one. Since morning, I have seen houses after houses broken. South 24 Parganas, North 24 Parganas, they have witnessed the biggest, they have received the biggest wrath of this nature's fury. South 24 Parganas in parts like Kagdeep, in parts like Bokhali, Gosaba, Shagor Islands, Mushumi Islands, houses after houses completely ravaged. And Tanvi, even though it's pitch dark and I can barely show you anything, even though I want, but then onto my right, not a single shop is standing tall. Onto my left, there are school buildings, boundaries of which have fallen down. Hundreds and hundreds of trees have been uprooted. While coming here, I just saw a huge banana tree, could be about 100 years old, uprooted, and the root circumference was as tall as a 3-story building. That can possibly give you a sense of this storm and the impact it had on the ground. So houses after houses completely destroyed. I'm mostly referring to kacha houses and houses with thatched roofs. In the city of Kolkata, yes, there are parts where still power hasn't come back. And I was talking to people, they were saying that families do not have drinking water. So the state government has formed a task force. It's a Herculean task for the state government. The state government has formed a task force, us corporation people and other respective departments to be on the ground and find out where are these pockets where people are in desperate need of help. And be it anything, help has to be reached to them. As basic as water, drinking water is a must. So there had been large parts of the city Kolkata, completely inundated. And the last reports that we received, the cyclone speed, that velocity was over 100 kilometers per hour. Imagine city like Kolkata with an urban setup and mostly with a population density witnessing a wind speed of over 100 kilometers per hour. Districts like South 24 Parganas, North 24 Parganas, Howrah, Hooghly, East Midnapur, West Midnapur, they have all sustained the wounds of this nature's wrath. But on the ground, Tanvi, having seen it, length and breadth of South 24 Parganas, and having seen videos and pictures which I have been receiving from my city, it would take time for Bengal to get back to its feet after this. Yes, the state government admits, on one hand, we have the COVID challenge. On the other hand, we have the challenge of the migrants coming back. And on top of everything, this is a natural calamity. And the reason why the state government has requested each and everyone to come out of their political bias and differences and fight this together, we have to wait and see whether this too would lead to any political face-off between the state and the centre. But Mamata Banerjee had categorically said that the Prime Minister should intervene, should himself take stock of the situation.
Okay, but Tamal, let's talk about, what you were describing just a short while ago, what you've seen, the kind of destruction, houses completely wiped off. What about the people? Now, where are they taking shelter? Are there enough shelter homes? Because like you said, this is also the times of a pandemic, which just makes it a bigger challenge. How many people have been displaced in these areas?
Well, we know that 5 lakh people have been evacuated, more than 5 lakh people have been evacuated, and mostly from the coastal areas. Now, they were all brought to the shelter homes, cyclone shelter homes. But Tanvi, the concern is Shagor Island is an island. Musumi Island is an island, and there are a cluster of such small islands which has got habitation. And those islands are completely disconnected now, because in order to reach there, you have to cross a river. And those riverine belt, that riverine belt is quite turbulent. So the ferry services are not on, even though the state government is trying to use some way or means to reach out relief materials. But if you ask me what's the condition over there, I cannot possibly give you a first-hand account, even though I want to go there and see it myself. Yes, there are several places in South 24 Parganas, and especially in Sagar Island, parts of Holdia in East Midnapur. It has seen massive destruction. More than 5 lakh people have been taken to safe shelters, but then they are the same people who want to go back. They want to go back to their base because they had left behind their houses, and then they don't know whether their houses are still standing or not. And Tanvi, it's not been over 6 months. In November 2019, Bengal had witnessed Bulbul, one of the deadliest storms till then. And people had lost their houses as once again in South 24 Parganas. So even though this time they had more was more participatory in nature, when it came to going to the relief camps and shelter homes, because they understood the gravity of the situation. They had seen what really happened during Bulbul, so they did not want to take a chance this time around with their lives. But then I met with families, Tanvi. They were talking about what they have lost during Bulbul, and they were still building their houses, and they had to leave their house and come back to a safe shelter once again, and they are unsure when they go back whether they would find their houses once again or not. The bits and pieces they have managed to gather so far. So yes, when you talk about public suffering, people suffering, only when you see it in your own eyes, it seems like you can feel it in real. And I do feel for what they are going through. I've spoken to hundreds of people today. One gentleman who works at Kolkata at a restaurant as a waiter had been out of business, out of job for the past 3 months because of the lockdown. And he stays somewhere in South 24 Parganas, and he lost his house now. So it's a double whammy for him, and just not him. It's a double whammy for the entire state. And Tanvi, everyone should come together to pray for Bengal. That's the least we can do, and that's the most Bengal needs at this hour of crisis.
Okay, all right, Tamal, thanks so much, and for bringing us the reports through the day, and also joining us right now to give us a complete summary of what's happening and the kind of damage that has been done in the state of West Bengal. It is going to be a big challenge going forward, but thanks so much for joining us. Let's also say good evening to Jajati Karan, senior journalist, joining us from Bhubaneswar, and Shikha Mukherjee, also a senior journalist. But first up, let me go across to Mr. Randeep Kumar Rana, DIG Operations for NDRF, with us this evening. Again, Mr. Rana, thank you for joining us and giving us your time. If you can, also give us a sense of what your teams are telling you, the extent of damage there on ground in West Bengal, and how much, how many days can it take for the basic help to reach people?
Good evening, Tanvi and viewers. Actually, our teams, they are available in all the affected areas since last 5 days. And before cyclone landfall, our teams have been moving from locality to familiarize the people, to advise the people about the intensity of the cyclone, about the quantum of damage it is going to bring, and advising them how to take added precautions in view of ongoing COVID pandemic and the coming cyclone. And as a result of which, lot many people, they were convinced to go to evacuation centers, and in a way, though lot many damage has happened, but the saving of lives, that was the first priority. To an extent, the state administration and the central government agencies, they have been successful in minimizing the human casualties. As of now, ever after the landfall happened, our teams, they immediately came out to the affected areas and started clearing the routes, because lot many trees, they were uprooted and they had fallen on the road. As a result, the roads were blocked. There was no transport moving, and lot many electric poles, they had also fallen down. So entire through the night, the process continues non-stop. Our teams, they are regularly into the process of cutting and removing these obstacles from the roads, and many of the roads, they have been cleared. The damage to kacha houses, semi-permanent houses, IMD had given a pretty accurate forecast about the amount of damage and what kind of structures they are going to suffer damage due to the intensity of this cyclone. Based on those predictions, the people were advised to move to evacuation centers, and there is a lot of damage to semi-permanent and kacha houses. So the electricity in except 24 South Parganas, there is partial restoration of electricity and landline and mobile connectivity in other districts, and the process of restoration, it is going on continuously non-stop, but I'm sure it is going to take some more time to restore these services fully to the satisfaction of the people.
Okay, Mr. Rana, so is there any kind of a feedback about what additional help will be needed? Of course, the Chief Minister has come out and said this has been the worst that the Bengal has seen in recent times, and that all the support will be required. Even the centre needs to step in right now. In NDRF's view, and the assessment that the NDRF has done, what kind of relief and rehabilitation work should we brace ourselves for?
First and foremost priority as of now for the state government and all other agencies is to provide the immediate assistance and relief to the people who have lost their houses and who do not have any shelter as of now, and the people living in evacuation centers. State government is doing a good job, and stakeholders of the state government, they are reaching out to the people not only in evacuation centers, but in the localities also. And on part of central government, there are clear directions to NDRF and other stakeholders also to go all out and provide as much assistance possible to the agencies of the state government as can be done in the present circumstances. And resultantly, NDRF, though 21 teams are deployed in West Bengal, 4 additional teams, they are in the process of being airlifted to the state. 2 teams, they have already taken off from Pune, and they will be landing in Kolkata in about another 50 minutes. Another 2 teams, they will be airlifting from Tamil Nadu Rajali Air Base, also likely to reach Kolkata by 9 tonight. And as such, we'll be having around 26 teams working in the affected areas tomorrow morning onwards. As of now, 21 teams, they are working round the clock.
Okay, all right. Mr. Rana, thank you so much. I appreciate you joining us and giving us your time. I really thank you for joining us right now. This is the latest that we're getting from the NDRF, the kind of work that is being done on ground right now, viewers. Of course, suffice to say that the extent of damage, for the state government to still give us a lot more details of how the work will go on from here. Tamal was mentioning that while the initial figures of casualties stand at 72, that itself is a big figure and of course extremely concerning in terms of the impact and the damage. Of course, 5 lakh people had already been evacuated. NDRF was also already on the location, and the advance forecast by the weather department help the state and the relief authorities prepare for it on time. That doesn't mean that the impact wasn't horrifying, that the cyclone itself wasn't horrifying. And I just want to take you through some of the visuals. One of the visuals that really shocked us in the morning was what happened at the airport itself, at the Kolkata airport. The runway was underwater. Some of the aircraft were also partially submerged at that point of time. One video actually showed a roof of one of the structures that had completely caved in, and it was just water everywhere. This was the trail of devastation that was left by Cyclone Amphan that hit the state last evening. Of course, now the airport is in a better state, and already there was updates coming in that some cargo flying has begun to take place from there. The second visual that I wanted to show you was a lot of these visuals came through the day about the streets of Kolkata, how badly they were waterlogged. Cars were buried under trees that had completely been uprooted, had fallen on the road, damaging quite a few cars. Another instance where we saw the petrol pumps roof had completely collapsed. Then we had visuals showing more of tree uprooting, completely blocking the roads. In fact, our reporter Shreyasi was in Kolkata, went outside today and got us these reports as well, showing the blocked roads and the kind of devastation that had happened. Similar scenes were witnessed in East Midnapur, so it wasn't just the Kolkata city itself. Trees uprooted, houses completely destroyed, wiped off. And again, this is because of the high-speed winds that hit this part last evening. More visuals that we will keep running through this broadcast, but let me also go across to our other panelists who are joining us right now with more updates. Shikha Mukherjee, a senior journalist, also with me this evening. Shikha Mukherjee, where you stay, what's been the impact, and what did you experience yesterday? Let's begin with that, actually.
Actually, the impact has been, I think, across the city, absolutely devastating, because it's difficult for me to exit the road on which I live because of the number of trees that have been uprooted and are on the road itself. It's going to take a little bit of time for the teams which are really short-staffed to be able to cut through all these trees, because some of them are quite old and they're large trees. And it's going to take time to clear the roads. So, there is first the impact of a storm of the intensity, of a cyclone of the intensity of Amphan. And then there comes the second experience of being cut off from everything. Telephone connectivity was bad. Mobile networks were not functioning. The internet was down. Cable television was off. The kind of isolation within which people were stuck. I think that is what has caused that has also actually brought home to everyone living in the city the intensity of the cyclone and its impact on lives.
Yes, and for how long, was the electricity gone for most part of the city? In your own assessment, how long will it take for the city of Calcutta itself to emerge out of it? If there will be additional help from the center that will be needed now?
See, Calcutta has been through many cyclones, not of the intensity of Amphan, but definitely it has been through Aila, it has been through Bulbul. There have been several and it happens every few years. And therefore, Calcutta has a resilience and a capacity to cope with returning very quickly back to normal. Once the roads are free of water, once people can start moving around, once public transport is available, Calcutta actually gets back on its feet very fast. There is a habit of coping, but what I think worries me greatly is that this time it is like what happened with Ayla. It is the Sundarbans area which has taken the brunt of the cyclone, and it is this area which is already, it's already in a bad shape. One has to realize that Sundarbans is one of those areas from where huge numbers of migrants leave the place and go out looking for work everywhere across the country. Therefore, when Sundarban's capacity to bounce back on its feet on its own is going to be very, very limited. And this is where the center and the state have to work overtime, not business as usual. We know exactly how the there are endless squabbles about the money asked from the state and what the center releases, when it releases it, and all of that. This year, the center needs to act fast because the capacity of the people who move out, earn something, and rebuild their lives has been snatched by the pandemic and the lockdown and the fact that the economy is frozen at this point in time.
Yes, absolutely. It makes the challenge even bigger, more difficult, and what we need at this point is the state and the center and all agencies to come together and help the people out. There is a pandemic, there is a lockdown, there is now a disaster, a natural disaster that's taken place and impacted people. Shikha Mukherjee, thank you for joining us tonight, and telling us, the state of Calcutta and Bengal. Very quickly, I want to go across to Jajati Karan as well. He was with us yesterday giving us the updates from Bhubaneswar for Odisha. Jajati, any further details that have emerged now in the aftermath? What's the assessment of on-ground damage for Odisha?
Well, the cyclone has not battered Odisha as it has done in West Bengal, but there are 4 coastal districts, that of Baleswar, Bhadrak, Jagatsinghpur and Kendrapada, which has badly been damaged due to the cyclone Amphan. And because in these 4 districts, the wind speed was as high as 80 to 100 kilometers per hour. The most damage has been done is that of the infrastructure to the electricity department. What we are getting to learn is that from the state government's initial assessment is that more than 45 lakh people have been impacted due to the cyclone in Odisha itself, in 1,500 panchayats. 2 lakhs people have been evacuated during the cyclone, and the very next day, that is today, they have been sent back to their respective places because there was no necessity to keep them in the cyclone shelters anymore. However, the damage to the electricity department, that will take some time, and the Odisha government and the Chief Minister himself has given time to the department of another 48 to 72 hours to restore electricity in most part of the state. And 80% of the restoration will take place in maybe another 48 hours, but mostly in the interior areas it will take some time. Meanwhile, Chief Minister Naveen Patnaik has offered help to the West Bengal government because they have quite an experience in handling with this situation, because exactly at this time of the year last year, the cyclone Foni had happened, and that is exactly I can understand what the West Bengal people have been going through right now, because Foni ripped through Odisha and passed through Bhubaneswar, where the eye of the storm passed, and that is exactly what happened in Calcutta yesterday. So these damage will take time. In Odisha last year, it took almost a month to restore the normal services across the state, having such an experience of almost 2 decades now. So it remains how West Bengal is coping with the disaster this time around.
All right, Jajati, thank you so much for joining us and giving us an update as far as Odisha is concerned. Lakhs of people impacted there as well. Even if the damage is not as big as Odisha has seen in the past, it's still going to be a mammoth challenge, even for the government there and the authorities on ground to help these people rehabilitate while also dealing with the pandemic. Jajati, thank you for speaking with us. In fact, I just also want to quickly go across to Mohammad Safi Shamsi, also a senior journalist on the phone line with us right now. Mr. Shamsi, thank you for speaking with us. What more information can you give us about the extent of damage, especially outside the city of Kolkata as well?
Yeah, well, let's. What we have gathered since yesterday, as we saw through how the wind, actually the storm built up and it came to Calcutta. Thereafter, ever since it struck Calcutta since last evening. First, let me tell you about South Bengal. The districts in southern Bengal got affected severely, and in this, the coastal districts primarily, which are part of South Bengal, got affected. There is still assessment being done, but what is coming forward is that there are many villages. There can be figures which are being assessed, so I will not put the number exactly what it is, but 72 deaths are being told, by what has happened in Bengal, and out of these, there are 15 which are being said to be from Calcutta itself. There's compensation. The state government, the center are coordinating. NDRF teams are coming to Calcutta. 4 more teams have come to, are coming today. Was supposed to come today, and thereafter, the assessment is now being, it is going to take a little time, because if you recall, the last big hit that we had was Ayla in 2009. There were several cyclones, but Ayla was one which had struck us as a state very severely. And now with Amphan, this is unprecedented for many of the officials who are working on ground. And the assessment, let me tell you now about Calcutta. What has happened is the civic sources are revealing that, there are, there's still a lot of work that needs to be done. Around 5,000 trees. This is just an estimate. There could be more. Trees are still, need to be cleared. The roads have to be cleared. So coming to Calcutta, it is going to take a few more days before the city returns to normal life. There's still power disruptions in many parts of Calcutta. Streets are locked and stretches are waterlogged in many parts of city. Broadband connectivity is off since last evening for many parts of Calcutta. It's almost like most of Calcutta is right now, off the grid, if you say it that way. And as far as the normalcy which is expected in Calcutta is getting hampered, because as you know it's not only Amphan, but we are also following the social distancing norm. So it's a double fight for people in Calcutta. The city itself is finding it very difficult, and as far as I gather from civic sources, the major roads have to be cleared first.
Right.
And this is to be followed by the other arteries and roads, and it's going to take a few more days before we can expect the city's life to get restored to normalcy.
All right. Thank you so much for speaking with us and giving us those updates. I really appreciate you taking the time. Unfortunately, we couldn't get you live because of course, the network conditions. Now, before we wrap up, viewers, I want you to look at this report as well that Tamal got for us earlier in the day. As this cyclone wreaked havoc in South 24 Parganas' Bakali area, the workers had to evacuate their homes and move to the government shelters. In less than 24 hours, the storm had not only taken away lives, but also destroyed homes and shops. Take a look at this ground report.
In less than 24 hours time, the scene out here has changed drastically. This is the same spot where I started my day on Wednesday, where I started my morning broadcast, but now it seems to be a different plane altogether. Extremely severe Cyclone Amphan has simply not destroyed lives, but at the same time has taken these shops and houses, everything that came on its way. These people who had taken shelter, a safe shelter at a government accommodation, had left their houses, their shops behind, trying to save their own lives. And in less than 24 hours time, when they came back, they realized they have to start all over again. It's like collecting bits and pieces, whatever they can, whatever the extremely severe cyclone Amphan has left behind. Houses after houses, shops after shops have been completely destroyed. yesterday, we did see how the wind force had taken, or rather blown off, the asbestos and tin terraces and taken along with it. Little these people had any idea, once they come back, they won't find their shops or houses with roofs. Bulbul had a similar effect. The extremely severe cyclone that happened in November 2019 had shaken their conscience and shaken their belief. But once again, extremely severe cyclone Amphan has kind of poked the same wounds, made them afresh once again.
Well, I'm completely out of time on this segment, but I want to leave you with few visuals that we got today that actually show you the extent of damage. A roof of a school in Havra, viewers, completely blown away yesterday. That was the extent. That's how windy it was last evening. Trees uprooted, communication poles completely destroyed, damage. These trees not just blocking roads, but damaging cars. Homes completely destroyed. All the kacha homes along the coast completely wiped off. Fields wiped off. That's what's happened to Bengal. We're given to understand that Prime Minister Modi is likely to take an aerial survey of the extent of damage tomorrow of Bengal. The government of Bengal and the Chief Minister have reached out and asked for more help from the centre. Let's see how we now attempt to rebuild parts of West Bengal in the aftermath of this cyclone. Quick break. On the other side, we put the spotlight on Mumbai. Stay with us. Welcome back, viewers. We now put the spotlight on the city of Mumbai, the city with the highest number of cases, now fast approaching the mark of 25,000 cases. There have been nearly 900 deaths in the city. And obviously, because of the large population, because of the high number of cases and as well as fatalities, there's a huge amount of burden on the healthcare infrastructure. Now, the government has built some additional infrastructure. The government has changed the policies to ensure that the beds, that the hospitals are only for those who need immediate urgent help. The milder cases can now go home, but none of that still seems to be reducing the burden on the healthcare infrastructure. And I want to start off with one story. We've been bringing you these stories every day. It's been a continuous coverage for us, continuous spotlight on Mumbai. Today I bring to you one specific story before we go into our conversation. This is again a story from the city's KEM hospital. It's a government-run hospital. It has a capacity of about 414 dedicated beds for COVID patients. But it has 446 COVID patients already, right now as we speak. And there is some amount of impact that's thereby happening on non-COVID patients, the general patients who are also supposed to be treated at the hospitals right now, the important urgent cases that need to be addressed right away. Listen in to some of the people whom Disha spoke to on ground.
मेरा नाम तुलसी चू है और मैं यहाँ कल से आया हूँ और मुझे डॉक्टर साहब ने कहा है कि तुमको नोमिनिया है और कोविड नहीं है, लेकिन कोविड की टेस्ट करनी पड़ेगी अंदर। पर आपको यहाँ पे क्यों रखा है? अंदर मतलब अंदर जगह बहुत कम है और पेशेंट ज़्यादा है, तो उनके पास सुविधा नहीं है और ज़्यादा जगह की, तो हमसे कहते हैं आप बाहर जाके बैठो, घूमो फिरो। जब हमको IV वगैरह लेना है, दवाई का वक्त जब भी होता है तब हम जाके आते हैं।
उसके लिए डर लग रहा है कि वो वार्ड के अंदर जाने को अच्छा खासा इंसान जा रहा है।
कोरोना के बाजू पेशेंट के बाजू में खड़ा कर रहे हैं, उन लोग के खाट के पास बिठा के इंजेक्शन दे रहे हैं। ये तो गलत है ना। जो बीमारी नहीं होने वाली नॉर्मल को भी हो जाएगी बीमारी,
इसलिए डर लग रहा है और कुछ नहीं है।
पर आप बोल रहे हैं आप एक हफ्ते से यहाँ पे बैठे हैं,
तो क्या करेंगे? बाहर से तो कोई ये लेके कम से कम इंसान को थोड़ा बहुत तो ये करके जाना बोल के बैठ गए, क्या करेंगे?
तो अंदर जगह नहीं है।
कोरोना का पेशेंट है ना मैडम, वो उन्हीं के बाजू में ही बोल रहे हैं कि वहाँ पे रहो तो कैसे रहेंगे? नॉर्मल इंसान को भी बीमारी लग जाएगी, तो वो रिस्क क्यों लेंगे हम लोग? इसीलिए फिर बाहर हम बैठ रहे हैं. क्या
Well, this
करेंगे?
is what people outside the hospital were telling us. When we spoke to the dean of the hospital, he said that there is enough space for non-COVID patients, but they don't want to be inside the hospital for fear of coming in contact with the COVID patients, for fear of getting the infection. Listen in.
What happens here is as the patient comes into the KM hospital casualty or a triage area, they are either COVID positive or COVID negative patients. So once their test is done, if the test comes as positive, these positive patients are diverted to a dedicated COVID positive ward. And those who turn negative are treated still in a COVID dedicated negative ward. Now the intermediate patients who are waiting for the reports are the ones who are in isolation. The whole idea of making them wait for a bed is because the number of patients that are coming for COVID related treatment are definitely more than the requirements of beds. So what happens is once they are admitted, they want to go out and sit rather than sit amongst COVID positive or COVID negative patients. The whole psyche of these patients is they are afraid of sitting next to a COVID positive patients. Most of the times when we call up their names from inside the isolation ward, they are not around the isolation ward but sitting outside, and say one or two of them will always abscond from the ward, and then we just have to do a police case and try and trace them from their home and get them back to the isolation ward.
Now remember viewers, this is the same hospital from where certain videos emerged in the past that showed that dead bodies were being kept right there inside the hospital where COVID patients had been admitted and patients were being treated. That's how heavily loaded this hospital has been. Let's go across to Disha to get you a sense of what she saw on ground. Disha, patients seem to suggest there wasn't space inside, but the dean says the patients were choosing to be outside.
Well, certainly, Tanvi, it's a given fact here that if there is any patient who is suffering from any disease or, illness, and if the hospital refers that you need to get admitted, the basic what patient expects is a bed. But here, of course, when we entered the KM hospital, which is one of the largest here in the city of Mumbai, we saw that patients were actually sitting outside. One lady that we came across who spoke to us, she's a heart patient. She's been there for a week now, Tanvi, and she's been admitted over there, but due to non-availability of beds, the hospital staff asked her to wait outside, sleep outside, sit outside. Only to use the washroom, she goes inside the hospital. So these are the kind of stories that we literally came across. One of the person, of course, we met, he has pneumonia, and he's been asked by the hospital staff to wander here and there within hospital premises because they do not have beds to treat non-COVID patients. That is the message that is being communicated to such patients. And secondly, of course, at this given point in time, only one dose of injection they are being given through the day, and they have been asked that next day they will be given another dose. So here, of course, the treatment also goes for a complete toss. So as far as KM is concerned, Tanvi, it is treating currently COVID as well as non-COVID patients. Right now, if you talk about this particular hospital, there are more patients than the total number of beds. So that is why here we are looking at the state and the condition of the health of, infrastructure specifically at the BMC run hospitals. And time and again, when we speak to KEM administration, they deny all of this. And today on the ground level, when I saw, patients were absolutely sitting outside. So one of them was sitting in the garden area. One of them was sitting just outside the ward under a tree. So all of this is the situation of the non-COVID patients who really want to get the treatment inside the hospital.
Yes, okay, Disha, thanks so much for bringing us that story, because we are going to use that as a starting off point for our conversation tonight. We are going to actually ask, our panelists on what's happening, why are we not able to resolve this problem. So let's say good evening to the panelists who are joining us right now. I've got Mr. Charan Singh Sapra, spokesperson for the Congress party, and Shweta Shalani, spokesperson of the BJP. Mr. Sapra, the same hospital still struggling to take in patients. Why are we not able to address this problem again and again? The last time we spoke, we were told that now that the policy has changed, many people are being sent home and will be isolated and quarantined. There will be more beds available. We are building additional infrastructure. But you heard the patients today.
See, Tanvi, first of all, I appreciate your ground report, and it is definitely a cause of concern for all the Mumbaikars. Now, let me tell you that Mr. Hemant Deshmukh, the Dean of KEM Hospital, has tried to answer all your questions. Let me add something to it. The Municipal Commissioner, Mr. Iqbal Chahal, has preempted this situation. Therefore, yesterday he had a video conference with all the 24 Assistant Municipal Commissioners, and they all are instructed to take 80% of the beds of private hospitals. Out of these beds, 60% will be used for the COVID patients and 40% will be used for the non-COVID patients. Now, these non-COVID patients who are going to the BMC hospitals will be transferred to these private hospitals, and they will be getting better treatment free of cost, and they will be around better ambience and the better atmosphere over there. There will be no atmosphere of fear, like Mr. Hemant Deshmukh was saying, that these patients are fearing that if they sit next to the COVID positive patient, they might also get infected. So they won't have such a situation. The BMC has taken a cognizance of this yesterday, and probably in a day or two, more beds of the private hospitals will be added, and this situation which you have shown today will be eradicated.
No, but Mr. Sapra, no, I'm sorry. I find it a little, amusing that you are saying that he has preempted this. The BMC Commissioner has preempted it. This is not preempting it, Mr. Sapra. If he's decided to do this yesterday, the civic body is late. Very, very, very late on this issue. The KEM issue is not new. We have repeatedly highlighted how the hospitals in Mumbai are burdened. We have repeatedly highlighted how there is a shortage of beds. Every time we are told, no, now we are doing it. No, now we are building more things. Now we've gotten the private hospitals. Now we are getting the private doctors as well. How is it that every time we ask this question, we are told this? Yes, please.
See, Tanvi, this is an unprecedented health crisis. Every day, Corona changes its color. So the authorities also have to amend the decision. They have already roped in the private hospital doctors to work for these COVID patients for 15 days. The BMC has also decided to pay these private doctors separately. The BMC has also taken a cautious decision to do all the treatment under that health insurance scheme. So BMC and the state administration, they have been trying to change, they have been trying to amend as the situation appears. So this is an unprecedented health crisis. There might be some amendments today, tomorrow, day after. There might have been some earlier decisions which have to be changed now. So this is going to happen. Even the central government has been doing all this. They have been taking one decision, then the other day they have been changing the decision.
What new challenge from Mumbai have we discovered? We always knew this is going to be a problem where there are clusters and crowded clusters. We always knew once this disease reaches the slums, it is going to be a problem. We always knew that this city has a population of 1.28 crore people. And it will always be a big challenge. Yet, for a population of 1.28 crore people, Mr. Sapra, today we have only 44 dedicated facilities for COVID. We only have 9,387 beds. Not even 10,000 beds dedicated for COVID. We have 1,100 ICU beds. Dedicated health centers, we only have 43 ICU beds. This is nothing new. Is this the preparation for 1.28 crore people?
See, Tanvi, all the patients need not go to ICU. If the patients are serious, then only they are taken to ICU. Now, you know that the quarantine bed numbers have increased. The hospital bed numbers have increased. The state administration has inaugurated a 1,000-bed hospital at MMRDA, where you also have 100-bed ICU facility. Another 1,000-bed is coming up at the Geo Convention Center at BKC. There is a 1,000-bed hospital already at NSCI. There is some 1,200 beds at NESCO. So the administration is doing enough. They are taking the private lots also. As the cases, we are preempting that the cases are increasing. The private parking lots have been taken by the BMC. The quarantine centers are coming up there. Let me give you now data. there has been 50 lakh households who have been surveyed by the paramedical staff. Around 7.5 lakh people have been undergone thermal screening. 2 lakh senior citizens have undergone thermal screening. There are 95,000 quarantine beds in the city. There are around 43,000 beds which are institutional quarantine. I'm not talking about home quarantine. 95,000 home quarantine and 43,000 approximately institutional quarantine. So the government is doing maximum 43,000 institutional quarantine is enough for today. Maybe we are increasing tomorrow by adding on the private parking centers. So the BMC and the government, they are alert. They are doing all the possible what they can do to fight this COVID.
Well, I think, the new BMC commissioner and the government and the bureaucracy of Maharashtra government needs to move faster on this. The bureaucracy has completely been missing on ground. We've not even seen them step out to deal with the migrants crisis. That's another mess. The crumbling health infrastructure is another mess. After everything has been outraged about for days together, then we see some kind of a reactionary policy come out. No, I don't. I want to go across to, this is not even a question, Mrs. Sapra. I want to bring in Shweta Shalini. Shweta Shalini, every day we are seeing over 1,000 cases being reported in this city. On May 17th, 1570 new cases were reported, then 1185, then 1400 cases on May 19th. Yesterday, there were 1372 new cases. Do you think we are building up our infrastructure to match this?
Absolutely not. So first things first, Tanvi, one thing that I completely agree to Sapra ji is that yes, this is an unprecedented crisis, and I would not want to politicize this issue. Hence, I do not want to comment on our hospitals, our infrastructures, the dean of the hospital. We saw Hemant ji coming over. The doctors, I think they are doing their bit. However, what I want to talk about is a couple of things. And Sapra ji has talked about data. Let's talk about data. One, we are talking about BMC. Please do not forget, it is the richest corporation of India. Second, we are talking about Mumbai. We knew the density of Mumbai. We knew, and if they had anticipated this, why were they not acting for the past 2.5 months? What did they do? Why did they, pass the rule yesterday? Why did they make convert the convention center into a quarantine center yesterday? It was inaugurated 2 days before. Why? Look at the data. Today, the death rate of Mumbai is nearly 17%, which means it is lowest in the entire country. The country is averaging at the recovery rate of country is averaging at about 40%. But in Mumbai, we are seeing a recovery rate of only 17%. It is lower than that of Pune. Look at the MMR region. The recovery rate is even more lesser. So you need to understand that mortality is higher than national average. Recovery rate is lowest. And the worst is the infection spreading rate is the highest in Mumbai because the density is very high. What are these people doing? The response is extremely poor. The chief minister is not walking out of his house. The BMC commissioner has been changed. You have now got the dean of same hospital, like Sion Hospital. The dean has changed 5 times. The only thing they do as reactionary response is change the messenger. They just shoot the messenger and that's about it. Because they can't shoot and stop the media and the opposition from talking. That's all they haven't done. But for everything else, they have fudged numbers. They have not followed the ICMR policy. They are not testing. The lowest data shows that the lowest test per case. That means they are not even testing according to ICMR. They are not testing the asymptomatic patients. That it also means that people who are COVID positive, their families are not being tested. Now, Sapra ji said that we have taken up the private hospitals. The COVID patients will move. But your story is about people who have other morbidities. What will happen to them? They still don't have beds.
Yes.
The beds are being used for dead bodies. And there are patients who are sitting outside and not even attended to. You see unlimited stories of one patient going to one hospital, then after that going to another hospital, positive patients being made to wait outside. You people covered the story of the entire ward being shifted under the Dadar overbridge and making a complete ward. The BMC actually made a ward there and shifted cancer patients down there.
No,
because you think this is what is...
Yes, in fact, Shweta, if I can just come into what you were saying, I want to highlight this again for viewers who've just tuned in and in case they missed the initial report that we played out. We had two specific case studies from the KM hospital, and believe you me, you speak to people in Mumbai, they will tell you there are hundreds of such stories and this kind of experiences that people are facing because of an overburdened healthcare infrastructure and that we are not doing enough to build that. Here is one story of Tulsi Chugh, 59-year-old patient, got admitted to KM 2 days ago, suffering from pneumonia. His COVID test has been taken, but the report hasn't come. It's been 2 days. He's not been given a bed. He claims that the doctors have told him, please wait outside. So he is waiting outside under a tree, outside the ward, under a tree. This is the state of affairs in the city of Mumbai, which has essentially become the COVID capital, which is essentially a financial capital of our country. But this is the state of affairs in Mumbai. He says doctors gave 1 dose of IV injection and then asked him to move outside, and that's where he's been sitting. The second story that Disha got for us was of Khatun Sheikh. She's a heart patient. She came to KM a week ago. Even for a week, since a week now, she's not been allotted a bed. Every day she says they are called once or twice by the doctors, they're given the medicine, they're given the injection, and then they are asked to go. And then they go and camp outside the hospital. Mr. Sapra, outside the hospital, a heart patient only goes inside to use the washroom.
See, Tanvi, in the beginning only I said that it is a cause of concern. Let me correct my friend Shalini, where she said what will happen to the non-COVID patients. I said that 40% of the beds of the private hospitals will be dedicated for the non-COVID patients, where they will get better treatment, better ambience, and free of cost. So don't worry. We are not treating non-COVID patients in a different way. See, the issue is that the BMC and the state government has increased its capacity. When this COVID started, there were only 60 to 65 ambulances with us. Today, we have 480 ambulances with us, and a dashboard has been prepared. The dashboard for bed management has already started. It is operational. You can go and you can have a look at it. So they have updated everything. They are increasing the number of beds. The number of doctors have increased. They have roped in around 6,000 doctors for this COVID patients. Now, these doctor management is also being regularized. So, as we are progressing in this, we are widening in all the spheres, whether that is hospitals, COVID beds, non-COVID beds, ambulances, doctors, treatment. And why you are seeing more cases in Mumbai? Because there is more testing in Mumbai. Out of 3.25 lakh people tested in Maharashtra, 2,30,000 people are tested only in Mumbai. So you can't say that we are not testing properly. And as far as the ICMR thing which Shalini was talking, it is ICMR who has said that non-symptomatic patients are not to be tested. ICMR has been changing its directions every day. So likewise, the state government also has to amend its directions. We are testing the maximum. We have all the testing kits. In fact, the municipal commissioner has today gone ahead and said if the private hospitals who are attaching with BMC, if they need PPE kits, BMC will give free PPE kits to the private hospitals in Mumbai.
Well, I'm sure they will need those PPE kits. The government and the civic body hospital themselves don't have enough kits. There is always now and then a problem there. So that has to be ensured. This is not done yet. We are going to continue with our coverage, viewers. I promise you that the focus on Maharashtra and Mumbai will continue for the sheer reason that this state and this city are on top of the list since this began. And for some reason, it's still not coming under control now. Either we are not being able to implement our policies, or we are not building up infrastructure properly, or we are not able to sense the gravity and the seriousness of the situation. This is the state and the city where the central government stepped in a few weeks ago and said, we are going to visit every week and see how the progress is being made. Yet over 1,000 cases every day, yet the recovery rate is half of that of our national rate. A deeper analysis and continuous coverage is needed. And we showed you yesterday the visuals that were coming from many parts. In sealed areas, not just containment zones, sealed areas, people were walking around freely as if nothing has happened. This is the level of implementation. To the extent that the MHA had to come out today and issue an advisory and a warning to the states to ensure stricter implementation. Is this how we are going to ensure lockdown in the city of Mumbai? Think about it. Thank you so much for joining us.